Hi, everyone. Welcome to Mama Wears Athleisure. I am your host, Mariela de Santiago, a first-time mom. We focus on all things mom with tips to help make life easier and more organized for all you mamas out there. Hi, everyone. Today I'm here with doctors Rachel and Nicole, and we're going to talk a little bit about pediatric chiropractic care and how that works with babies.
I'm Dr. Nicole Wong-Homer, and this is my wife.
I'm Dr. Rachel Wong-Homer.
And we have a chiropractic practice. We are pediatric and perinatal chiropractors in Kearny Mesa, San Diego. We own Sprout Family Chiropractic. We're celebrating 1 year last month, so that's a fun celebration to be had. We take care of whole families, but our passion is really taking care of children and pregnant and postpartum mamas.
That's awesome. So I hadn't really known about a pediatric chiropractor until I met both of you, actually. So would you mind sharing what is a pediatric chiropractor and what do you guys do to kind of work with a baby?
Yeah, that's a great question. You are not the only one to say that, pediatric chiropractic has never even been on your radar, or you've never even heard of it. Most of the time when people think about a chiropractor, they're thinking about a chiropractor for an adult. So they're thinking, okay, you guys help with neck pain, back pain, headaches, those aren't really common things that we know babies deal with or struggle with. And so, but pediatric chiropractic, it's not like chiropractic for a little baby. Babies aren't mini adults, is what we say. Like they're different neurologically, they're different physiologically, they're different even anatomically. The certain things aren't fully ossified or formed yet. A pediatric chiropractor is somebody that is specialized in working with the specific neurology, anatomy, physiology of an infant, of a child. And that looks really, really different from what chiropractic looks like on YouTube or TikTok, like for an adult. There's nothing like big pops or cavitations, or you don't even adjust the same way. So we say adjusting an infant or a baby is like placing your finger on a stick of butter and waiting for it to melt. That's how easy and gentle pediatric chiropractic is. And so pediatric chiropractic is, we obviously work with different cases. Like I said, they're not coming in for neck pain, back pain. They're coming in for things like colic or reflux or difficulty sleeping or chronic ear infections, trouble focusing for our older, toddlers or school age kids. And so I can let Dr. Nicole explain a little bit about like how we help with that or how an adjustment helps with that.
Yeah. And then if you could also add what some of those benefits include.
Yeah, absolutely. So our focus or our perspective on health as pediatric chiropractors, specifically neurologically focused pediatric chiropractors, looks through the lens of what is the root cause of many of pediatric or childhood conditions. Really, what we found through working with case after case after case is that it really gets to the nervous system. So the nervous system, you may or may not know, or your listeners may or may not know, is the master control system of the body. And so when we want to make the most impact or we want to affect the most change for a child's growth, development, health trajectory, we're going to look to the root of what controls everything, which is the nervous system. And so what we see is a shift more now than ever, a shift more towards what's called the sympathetic nervous system or sympathetic dominant side, which is that fight or flight or protective or survival mode state where we don't want kids to be on that side. We say that there are 3 baby basics: eating, sleeping, and pooping, and kids should be able to do all of those with ease and with comfort. And those are the fundamental things that we see kids struggle with. And then parents tell us over and over again that these things, parents are told they'll grow out of sleep troubles, they'll grow out of feeding troubles, they'll grow out of behavioral or emotional dysregulation, but in their gut, they know something is wrong. And so when we work with the nervous system, when we do our adjustments, what this does is shifts or rebalances the nervous system of a child to not be more in that fight or flight, go, go, go state, but in that parasympathetic, more regulated, more rest, digest state. And so how that ties back to all the cases that we see, like Dr. Rachel said, we see so many different cases, and it's kind of like, how can chiropractic or pediatric chiropractic help with all of that? Well, that's why we really get to the root of everything, which is the master control system. Like I said, when we fix the root, we allow everything else to function the way it was supposed to, the way it was designed to, so to speak.
To answer your question, the benefits are far ranging. You know, some kids come in, they're sick every time they go to school. You know, they're the kid that picks up everything, and you know, it doesn't seem like all the other kids in the class are sick 24/7, but they're always getting sick. They're always getting ear infections, or they can't sleep, or they can't focus, or they're not pooping. That's a big one. They're constipated, and so those are some of the things that parents bring their kids in for. And those are really some of the biggest benefits of pediatric chiropractic, regulating the nervous system. And all of those things get better because the body knows what to do. Like, it's amazing. A baby's little body knows exactly what to do. You don't have to teach its gut to process food and poop out the bad stuff, right? They're born knowing how to do that. It's just if there's interference or if there's any miscommunication between the brain and the body and the brain, sometimes those things, they're more challenging.
You had mentioned a few things. One, when we think about a chiropractor, we kind of think about, at least I do, I think about like the popping and all of these different bones realigning, or, you know, just what I guess you would see where you just have somebody like hold you and then all of a sudden they like crank your neck and you're like, oh my gosh, I can't believe they did that. Being that I'm probably not the only person that thinks of chiropractic that way, what are some common concerns you hear from parents regarding having their baby seen, if that's kind of like the picture that we have in mind?
You hit the nail on the head with the first and foremost concern or question is, you know, I've never seen a baby or child be adjusted. Like, what does that look like? We get that question a lot, and we love that question because we get to explain how we adjust differently. We call it a neurotonal approach, where there's no twisting, no popping, especially for infants. You know, we've seen babies on the way home from the hospital before they even go home, as young as that. What a parent wants to know is this safe for my child? What we explain is, just like Dr. Rachel said, the adjustment is so gentle that many times, especially for our very young patients, it's using sustained contact. So if you think of checking the ripeness of a tomato or an avocado, or even pressing with your pinky finger on your own eyelid with your eye closed, that pressure that you would put, that's about as much pressure that's needed to specifically and gently adjust an infant. A lot of those things that you see on YouTube, TikTok, Instagram, and all of that, they get the clicks, they get the views, but it's definitely not the same as a pediatric adjustment. So
that is the number one question that we get, is what it looks like. But I think specifically in our office, we run neurological scans. So we have 3 different neuro scans in our office, and it's what we use as an objective measure to see what is your child's nervous system currently doing? What does it look like? Is it stuck in fight or flight? This isn't technology that all chiropractors use. You know, some use x-ray, some use other exams. Obviously, we don't x-ray our pregnant or pediatric population. And so we use these neuroscans, but most of the times parents have never heard of them. That's kind of the next question after, is the adjustment safe? Is, okay, what do these scans do? Are those safe? We do 3 scans in our office. We do thermography, which is like a really fancy thermometer that's really measuring the temperature at every single spinal level. And then we do an EMG, which is a neuromuscular scan. And then we do a heart rate variability scan. Parents are wondering, what are these things and are they safe? And so our number one thing is, yes, we've done these on 48-hour-old baby. They could be done on patients as old as you can think of, because these scans, this technology is all reading output from the patient's body. Temperature, for example, heat coming from baby's body. There's nothing going into their body. It's just reading what their body is putting out.
Hey everyone, it's your host, Mariela. We have a giveaway in July, so be sure to check our website, www.mamawearsathleisure.com, for all the details on how to enter for your chance to win an original Sprout gift set. What would a visit to your office look like? For example, back when my son was having some issues with his tummy, we were considering going to a chiropractor, but it was just kind of hard to think about, like, well, what is a visit going to look like?
In our office, we have our first 2 visits being more extensive, which means they're longer. They are primarily focused on information collecting, health history, health goals, where chiropractic can fit in with a parent's goals for their child. And that's also when we do the scans, the chiropractic exam. That's the first day. And then the second day is really where we go over everything. We go over all the findings, care recommendations. But a regular visit, what we do is we assess for what's called subluxation. Subluxation is essentially stress and tension stuck in the nervous system. You could think subluxation, stress stuck on. And so what we do at every visit for every age patient is look for and assess and measure subluxation. And throughout the entire assessment, we're looking for that. And then we address or correct those subluxations, removing that interference that Dr. Rachel was talking about from the nervous system. Like I said, the first 2 visits are very extensive, so they're a bit longer. The typical visit where a pediatric patient is getting adjusted, it typically takes maybe 10 minutes or less. Some kids lay right on the table. They know the drill. Some pediatric patients, they want to be playing while we adjust them. We meet them where they're at. We sit on the ground. We follow them. We run around. Parents sometimes lay on the table. Child or baby goes chest to chest, and we're checking them while they're on mom or dad. So it really depends on where a child is at, comfort-wise, how big they are, and all of that.
So it sounds like the priority is really just making sure that they're comfortable and not feeling like they're being invaded or forced to do something that they're not okay with.
100%. Yeah, it's always about patient preference, patient comfort, and we want every visit to be a positive experience, especially if the thing we're trying to help with is stress. We don't want to induce that on our littlest patients. A lot of times the first visit, kids might be like, I don't know what's going on, what are you doing? Why are you feeling around back there? But then after a while, like a couple visits in, they know the drill. They come in, they lay right on the table, or for the little infants, it's like they lay right in the pillow and they're waiting for their adjustment. So it's pretty cool to see that shift.
I love that. So for a parent that is looking to go see you, is a doctor referral required, or what do they need in order to prepare to come see a pediatric chiropractor?
You don't need a referral. Chiropractors are portal of entry providers, which means you can just schedule with any chiropractor you want to see. The things that they need to know, or when looking maybe specifically for who they would want to go see, as with any other healthcare provider, you always want to do your research, check out their website, see if the vibe is right, see if they actually work with kids. Seeing someone's website is pretty telling, are there pictures, or do they actually have blurbs talking about working with kids? Because really all chiropractors can see kids, but there's a difference between specializing in pediatric chiropractic and being able to see a child patient. Definitely doing your own research. There are several other directories you could look at. They're trained in a specific thing. For pregnancy, if you've heard of Webster technique, that's a specific technique used on pregnant patients. And so, you would see if they're certified in that, if that's important to you. Similar for kids, we're part of an organization called the Pediatric Experience. All pediatric experienced doctors are trained to use these scans that we mentioned and to care plan out a specific individualized care plan for your child based off of their needs and what the parents' goals are. And so every office is going to be a little bit different. That's just what we've found and noticed in chiropractic. Checking out their social media. We know moms are on social media all the time now, and you can tell a lot about a practice or any business based off of their different social accounts. Definitely doing your research is good for looking for any healthcare provider.
Do you have any other tips, suggestions, or recommendations for parents that are considering visiting a pediatric chiropractic?
Before going, one, I would say if there are 2 partners or parents involved, making sure both are on the same page about care, because that's something that we have noticed, making sure both parents are comfortable. One parent may not have chiropractic care on the radar for their child, and one may be all in. And so making sure you're on the same page with that. And also
if you want more resource, on our website, we have a blog that kind of talks about the different conditions that a child might have that chiropractic could help with. That's more specific to, let's say your child is specifically struggling with sleep, or they're specifically struggling with sensory processing disorder, different things like that. That's a good way to help see if a pediatric chiropractic would be right for whatever your child is dealing with, is reading other people's stories and seeing what exactly is chiropractic doing to help with this specific condition? And maybe are there any other things that I could be incorporating at home to help with this as well? So we have a blog on our website that we post. That's what we think is a good resource for parents that may be considering pediatric chiropractic. But because there's a lot on Google, and you kind of can go down that rabbit hole and see all different sorts of opinions. Finding a couple resources that you trust and are well versed in what they're talking about is really important for any mom, for anything, not just pediatric chiropractic.
Yeah, you made a very good point. There is so much on Google, and sometimes it's kind of hard to differentiate what is opinion and what's factual, right? So it's very easy to get overwhelmed.
We tell all of our parents, but specifically our moms in our office, mom instinct and mom gut is the strongest superpower that you have. And if you feel in your mom gut that something is not right and your child is struggling or continues to struggle, or there's just something beyond what you're already doing, listen to that, because it's inexplicable, but it's so powerful, that mom instinct. So whatever that's leading you to as a parent, definitely follow that.
Thank you so much. I appreciate you taking time, sharing all of this. I feel like I learned a lot. I'll have all of your information linked, as well as that blog, in the show notes. So if anyone is interested in checking that out, they can.
Awesome. Thank you so much, Mariela. We had so much fun doing this.
Thank you.
Thank you for listening. Tune in next week for our next episode. You can find us on Instagram for more updates and tips. Be sure to subscribe wherever you listen to your podcasts and give us a review if you like us.